So that will comment. All right, so your speaking time starts now.
Okay. Good morning. I am Dr. Yusuf. May I confirm your name and date of birth, please?
My name is Tunde and I'm 50 years old.
Okay, great. So from here, I can see that in our last visit, I prescribed some medications for you because of your diagnosis, Parkinson's disease. How is that treating you? Do you have any concerns about that?
Oh, well, doctor, to be honest, I've been really concerned because I'm trying to see if there are other alternatives to taking this medication because I really don't like taking drugs. So, and that's why I came back and to see if it's possible that you give me other therapies that don't involve me taking medications.
Oh, okay. So you said that you would rather take alternative medications instead of the one I prescribed for you. Is that correct?
Yes, doctor.
Okay. I think I would like to explain the medication to you and your diagnosis properly. Maybe this will help you see reasons why the medication is very, very important in managing your condition. So I'll start with the condition first, and then I'll go into the medication. This way, I'm going to progress to how it happened and how the of the. So you have Parkinson's disease, as you know, and this is something that happens. It degenerates a part of the brain. There's a brain tissue that is seen to be degenerating as time goes on. And this degeneration of this part of the brain usually cause some symptoms like you have been experiencing. So it will affect the way your muscles and your muscles operate. So your movement, your leg movement, your hand movement, the way you speak might be affected. As continuous happens, you are going to feel or get more symptoms is related to this condition. That's why it is important to tackle this exactly as in the part that is happening. Now, that part of the brain that is released, that is degenerating, usually release a particular hormone, and that this is what helps you to maintain the muscle function of the things that you're experiencing. This medication I'm prescribing, or I prescribed to you earlier, it is supposed to replace that hormone that is not being secreted. It's supposed to help to do two things. Number one, it's supposed to help the degeneration process to halt it, to stop it. And secondly, it will also help you to provide the adequate hormones and chemicals that is needed for you to operate functionally, for your muscles to actually get better and better, just to make sure that everything works perfectly fine for you. It might not return to how it was before, but it will help, halt the process and then help it your muscles better. Do you understand?
Oh, well, I understand, doctor, but must I still really take medications? Because really, this is a whole lot.
Okay, so if it was a condition that was something that has a outright cure, perhaps an infection or something that has an outright cure, we usually prescribe medications for a short period of time, and then once the progressive. So you are supposed to always take the medication so that it can stop the way that the degeneration happens and help your muscles better. I mean, I'm sure you must have seen some improvements since you started taking the medications from now, haven't you?
Oh, well, there's been some level of improvement. I'm saying, are there no other things that could help me, doctor? Like, probably exercise, acupuncture, or massage that can really help me with this muscle weakness that I feel, due to this Parkinson's disease that I was diagnosed with.
Of course, of course. So see, aside the medication that was prescribed to you, there are other things that we can look into, but it is not a complete alternative for the medication. It is an adjunct, something that should add to it to better help you, progress well. So one of the things is physiotherapy. So you see how you are taking the medication, and on that side, the medication is helping your muscles to do better and stop the degeneration process. Physiotherapy is going to help your muscles will learn how to do activities like they used to do, help you with better muscle movement and things like that. So
All right.
physiotherapy and exercises are very crucial.
So Dr. Yusuf, your time is up. Your time is up.
It's up, okay.
Yeah.
Wow.
Your time is up. I'm sure you're amazed that your time is up. So I must commend you for your effort. And then please, for the candidate, in case the class ends, because in like 4 minutes it might end, just kindly rejoin with the same link. All right, so thank you so much, Dr. Yusuf. Who has anything to say regarding Dr. Yusuf performance? I mean, is there anything you think that, you missed out or something, and then I'll just crown it up. Is there anything that anybody has to say?
Empathy. His empathy was not there.
Okay, his empathy was not very sufficient. Who is speaking, please?
Dr. Tadese.
Oh, Dr. Tedase or Tadese, sorry. All right, okay. Any other thing else? Thank you so much. Any other thing? All right. Okay. Anyone has something to say? So that I will just quickly.
Can I come in?
Who is speaking?
Josephine.
Oh, Dr. Josephine. Okay, nice to have you around. Okay, so say one or two. Let's listen to you.
I was just thinking the class will soon end, but let me just start. Well, I don't think he encouraged this patient. If you have seen a patient with Parkinson's disease, you don't have to see patients before but Parkinson's disease, they don't really want to take their medication. We didn't encourage this patient at all. That's where the empathy comes in. And then I knew you were not going to finish this task because you went all the way doing your own thing and explaining neurogenesis and all that, which you just needed to just say what was written there and move on to your next task. Then another thing I noticed is you were not giving, the person wanted something alternative. You could have still made it clear to that there are alternatives, but you still need to continue your medication. You didn't emphasize that at all. So I don't know, maybe this is the first time, but I like the flow. You had a good flow. You had this good use of English. Apart from one, and I just knew you were a Yoruba man at a point. Thank you.
All right. Okay. So Dr. Yusuf, don't take these things to heart. I mean, everybody's learning, and then we're on the same page here. Thank you so much for your input. Okay, does anyone has anything to say? All right. I'll just conclude. So thank you very much, Dr. Yusuf. It was not a bad attempt. However, one of the things I would like to give you thumbs up for is, I think your introduction wasn't bad. I mean, Dr. Yusuf, I'll be the attending physician at this clinic today. Okay, might confirm your name and age, and then I told you my name and age. I think that's what you said. And then you can say, oh, looking through your case note, I can see that you're being managed for Parkinson's disease. Is that correct? And then you want to confirm, oh yes, doctor. And I can also see that you've been commenced on certain medications, to help you with this condition. So if I may ask, how has it been for you so far? And the patient can come in and start saying one or two things of the fact that it doesn't like taking his medication. Now, your first task tells you here that encourage him on how to persist with L-DOPA by explaining the importance of the medication and how to improve, the prognosis. First of all, I told you that I don't like taking drugs. Okay, the empathy was there, but was not very sufficient. Okay, so you can say. Okay, so I said my name was, I don't even know what I told you, maybe Tunde. I can say, so Tunde, I can understand that it might be quite difficult taking, medications, considering, the condition you're being managed for. However, I would like to encourage you, okay, or further tell you that these medications will be really, really helpful, for this condition. And then one of the drugs that was given to you was L-Dopa, and there are a lot of benefits, if you can be adherent. Okay, you're introducing new words now. So you are being marked with your vocabularies and the things you're adding. If you're adherent to use of this medication, as this medication will help you to improve your health outcome, okay, and then worsen and help you to prevent, deterioration, okay, of your symptoms, okay? Can I ask him, how does that make you feel? And then when you ask me, how does that make me feel? He said, that was from my own.
Gout is a medical condition that is caused by the buildup of uric acid. Uric acid is a chemical in the body, and when this chemical crystallizes, it forms, it builds up the things that the uric acid, when it crystallizes, can build up in some parts of your body, like your joints, and that's why you're feeling the pain in some of your joints and your big toe at the moment. Are you sure you can continue with this discussion, or you like me to give you some pain relieving drugs?
Oh, well, I really appreciate to see how, this pain can be relieved.
Okay, would you like to go on with this discussion, or you like me to some pain?
You can just advise me on, what pain medication will be okay for me.
Okay, I hope that's my explanation what gout.
Oh, yes, I understand. I think you've explained it well, doctor.
Okay, so the pain relieving drugs that can be, I would want to use aspirin because of some reasons I would not want to discuss with you about now. But there's a medical preventive treatment that can be used to prevent your attacks, and the drug is called allopurinol. I also wanted to know that it takes several weeks, days and weeks for your pain to become better. So I just want to tell you that over time, you feel less pain. I hope you understand that.
Oh, well, I understand, but I'm worried, about how long this attack will last, because I'll be attending my friend's wedding this weekend. So I'd like to, see how long this can last.
Okay, Tunde. I want to let you know that recurrent attacks are common. It's something that happens commonly, and there are some risks. There are some that mix occurrence that makes the attack come recurrently. But however, these things can be prevented. There are times that attacks can be recurrent, but they can be prevented. We like to know some of the things that can help you prevent recurrent attacks.
Oh, well, I actually appreciate that, but doctor, I'm not happy because I told you I'm attending a friend's wedding, and then you are telling me that it might take several weeks for my toe to get better. I don't understand why I will have another attack of gout again.
Tunde, I'm very sorry. I'm very sorry you're passing through this pain. I'm really sorry. I'm just trying to make you understand that over time, the pain will go. When you start using the drug, it helps break down some of these crystals in the joints, and it will relieve your pain to make you better. Do you understand that? Are you okay with that?
Oh, well, I think I feel more better, doctor.
Okay, can I go ahead now?
Oh, yes, please.
So I would like to also educate you to make you understand that there are some things that makes frequency of attacks. And some of examples of things that can help you reduce your attacks is trying to modify your diet. When you modify your diet to try to reduce alcohol consumption.
Right.
For
So
people
thank
that
you,
take
doctor.
alcohol.
Thank you, Dr. Biola.
And,
Thank you, Dr. Biola. Your time is
okay,
as
do you have any
elapsed.
questions for me?
All right. All right. Thank you so much.
Thank you
Okay.
for
Thank you
coming
so
to my clinic.
All right. Thank you so much, Dr. Biola. I'll be accepting, you guys' contributions. How do you think? I think Dr. Biola did not do bad. But I'd like to hear from anybody that has something to say so that I can put the icing on the cake. Does anyone have anything to say regarding our performance? Or if you want to leave it for the instructor? Okay, I'll just give 10 seconds and then I'll just comment. Okay, who is speaking, please?
Dr.
Dr. what?
Okay, for Faith, Dr. Faith.
Okay, all right. Please shoot.
I'll just want to in states. I think at some point you said it's my suburban. I don't know. I don't know if that is right.
Can you all hear me? Yeah.
Oh, hello?
Yeah, I can hear you. It was cracking, but continue.
Okay. Why? If it's or not. Okay. We're just maybe I was one that didn't really feel the empathy like that anyways. And then at some point, I think we were spending a lot time explaining, and then probably you could use some other words to get your patient someone. And then probably because what Dr. Ipka just said, they just few minutes ago about the tone. I think there was some about that from my end.
Okay. All right. Thank you so much. Thank you so much for your contributions. Thank you so much. I think they were spot on. They were spot on. Does anyone have anything to say so that we'll just comment and then we'll move to the next candidate to speak? All right. Okay. All right. So thank you.
Can I say something, please?
Are we speaking, please?
Can I say something?
Who is speaking? Sorry.
Yusuf. Dr. Yusuf.
Okay, Dr. Yusuf. Okay.
Dr. Yusuf.
Yeah. Okay. All right. Shoot, please.
Yeah. I would like to thank those that commented during my own speaking first. Thank you for your comment. I mean, made me note some things down. Also for our task, I'm not sure, but I don't think I think there are like two parts: linguistic and clinical communications. Yeah. For the linguistic part, the fluency and then the appropriateness and language. I'm not sure she did so well in those ones. So like she used a lot of pause fillers, and the fluency and the speed is not perhaps adequate. Then the language as well, that's the tone and the language, the professionalism basically. It is subdued, I think. I'm not sure. So maybe. So I'll just like to comment on those things so that I can also learn from. Thank you.
Okay. All right. Thank you very much. Actually, I appreciate you. So, all right. So just to reiterate what Dr. Yusuf just said. So, of course, for the speaking criteria, I have like two broad speaking criteria. You have the linguistic and then you have the clinical communication skills, all right? For your linguistic, you're looking at things like fluency, as I mentioned, appropriateness of language, okay, intelligibility, right? Grammar and expressions, okay, are the things that you want to look at for linguistic features. And then your clinical communication skills, you're looking at how well can you build relationship, okay? So your relationship building, understanding and incorporating a patient's perspective, okay? Very important. And also providing structure, okay? The structure, the way you are going to say, you know, your stuff, and then information gathering, how you gather information from the patient and how you also give out information, okay, to your interlocutor or to the patient. Now, okay, so all this being said and done, first of all, there was like a lot of fillers, a lot of gaps, okay, when you were trying to speak. The fluency was not very so top-notch. Was not too bad, but then was not still top-notch, okay? For example, the way you introduce yourself, you can introduce yourself very quickly, okay? Good day. Okay, I'm Dr. Ibuka, and I'll be the attending physician at this clinic. We're not necessarily right suburban clinic. Suburban is just like the setting of the clinic, but then clinic is just okay. All right. Okay, and then you just asked me for my name. You didn't ask me for my age. All right. You just said, Mike, confirm your name. And then I told you my name is Ibuka. And you said, what may I call you? I mean, I just gave you one name. There's no need to still say, what may I call you? Except I told you my name is Ibuka Biola. Then you can ask me which name do I prefer to be called. Okay. And then I can tell you Biola. Right. I said, oh, Biola, that's fine. All right. So you can now go on to say, okay, I can see that if you managed previously for, gout, is that correct? And then the patient, oh yes, doctor. So I'd like to ask them, what brings you to the hospital today? So in as much that you might actually have the case note of the patient, okay, that might indicate that you know that this patient has managed for gout. You should not assume that the patient came to you today for gout. Still ask the patient what brings you to the hospital today, because you might have the case note for gout and it's coming for diabetes mellitus or complaints of diabetes, okay, this time around. So you must ask, okay, what brings you to the hospital today? And then he'll tell you, oh, so doctor, it's me that will now start giving you all those history. Oh, I've had like 2 previous attacks, this gout, and then this current one seems to be very, very painful and stuff like that. When I finished telling you about that, you didn't use an empathic cue for me. Dr. Biola, you on the call. I told you that I've had 2 previous attacks, but this one is excruciating, it's so painful. Okay, and then because why you did not give me an empathic cue, because I followed up with another question. I said, okay, so I decided to come to the to ask some questions. So I would like to know what really causes gout. So because I asked you, I want to know what really causes gout, it made you to miss an empathic cue. I've already told you that this pain is worse than the previous ones. You already missed that. You're supposed to pick that, oh, I must use an empathic cue to start. So you can say, I understand that this gout condition that you're experiencing must be extremely distressing for you. And I'm sure you're quite bothered why you might be having recurrent attacks. And then you have to reassure the patient in that case. However, I can assure you that since you are present at the clinic today, you have no cause for alarm. We'll try to guide you and treat you appropriately for, better outcomes. All right, so regarding your question about gout, so I will give you just, an insight on what gout is all about. Is that okay? And the patient, oh, that's fine. All right, so gout is, a condition where there is buildup of certain substances, okay, around the joint. And that substance is called uric acid. You can just measure it in percent. And then when this uric acid, accumulates, okay, you may not want to use some big words. When it accumulates in the joints, okay, can lead, okay, to swelling and pain. Okay, something as simple as that. All right, and then when you're done, you are quickly going to, should I administer pain relief immediately and stuff? No, follow the task. Let there be structure. When you finish explaining, you ask quickly, immediately, do I understand? Because an explanation session. Do you understand what I just said? Oh, yes, doctor, I understand what you just said. And then for my own task is now telling you, now because of you went further than me, that's why I was not able to tell you, how can I relieve this pain? Okay, so now my next task here is telling me that, okay, so doctor, I want to know how, can this pain be relieved? Okay, then you will not be able to give me advice. So now remember that the patient is asking you a question. How can this pain relieve? It's a very brilliant question, right? I mean, it's a good question. Let me not say brilliant question. So you can say, I appreciate your questions, Mr. Tunde. Okay, you can also appreciate patients' questions. Okay, when you think that it makes sense. Okay, so I appreciate your question, Mr. Tunde. Okay, so I'd like to recommend certain pain reliefs that will be helpful, okay, for your condition. Okay, so you can be on, you can mention 1 or 2 things, and then you can tell the patient, try as much as possible to avoid aspirin. Also, there are other things that you can use that will be helpful for preventing recurrent attacks. Okay, and one of such drugs is allopurinol, and then what it does is to ensure that there is no buildup, okay, of this substance that I mentioned earlier, which is uric acid, okay, from accumulating in your joints. As you're explaining, as you're giving advice, for example, you just explained medical preventive treatment. I mean, you didn't tell me what the drug is going to be like. If you're going to mention the drug, you're going to tell me what the drug is going to do. Just a brief explanation, because it's a preventive treatment. Okay, so there's this drug that can be given that can help to prevent recurrent attacks. Okay, that drug is called allopurinol. Okay, you may just mention it in passing. You don't want to dwell on it. And what this drug does is that it helps, okay, to reduce the buildup or the production of this uric acid. Okay, so that you don't have it accumulating in your joints and then leading to, further gout. Okay, and then you ask him, is that something you would like to do? okay, because I try to give him something to do. Oh yes, doctor, I would like to try to see what I try to see, if I could commence these medications so that they'll be helpful for me. And then I'll now ask you a question from my own end. My question says, tell the doctor that you're worried about how long the attack will last. So I'm thinking, okay, so how long will this attack last? It has to be very conversational. All right. And then how long will this attack last? Blah, blah, blah. I have a wedding in the weekend. Now, remember, I'm telling you that I have to attend a friend's wedding in the weekend. Okay. So I'm asking you, how long will this last? Okay. So you have to come in straight and correct in this. You have to say things like, I understand that you're concerned, okay, of how long, okay, this condition might last. And then being that you have an important wedding to attend this weekend, you can see I'm reiterating what I'm seeing what the patient said, showing that I actually followed, showing that I'm actively listening. However, what I can assure you is that this condition takes some couple of weeks. You can even add your own weeks to your own. Like you can just say, it can take 2 weeks, even though they said it might take several weeks. You can just say it can take 3 weeks. It doesn't matter. You're still saying something. So this condition might take about 3 weeks. And before you experience, very significant improvement. I know this may be something you might not want to hear, but you just have to be patient with the process. And I can assure you that you will do just fine. And then from my own end, I'm telling you, doctor, I don't think I can wait these several weeks to get better. And I don't understand. I'm already angry now. I'm upset. I don't understand why, I should have another attack. And then the way you use the empathic cue was you just said, I understand they're sad. I'm worried. First of all, I'm worried the fact that I'm in pain. I'm worried the fact that I may not attend the wedding I want to attend. And then it's going to take too long for me to get a relief. So you have to come straight and clean. Quickly use your empathic cues, but be a little bit elaborate on it. Okay. I can understand you're quite upset, okay, and worried, about this condition and how long it may last before you get a relief. Okay. But I can assure you that, okay, if you adhere to the medications that I'm going to prescribe to you, you would, okay, attain resolution, within 2 weeks. And also the other medication I mentioned for the prevention would help you, okay, to reduce future or recurrent attacks. And then you check understanding again. All right. All right. Remember that before I started this lecture, this class, I told you of some words you can use to replace reassure. Okay. I will share those stuffs on the group. Okay. And then the next thing is that you're educating the patient again. So you're trying to give the patient more insight on things he can do. So after you ask this one, you check for understanding, and then you go to educate. All right. So Mr. Kennedy, I would like to recommend certain things that you would need to do that will be helpful, okay, aside the medications to help reduce, recurrent gout. So one of the things you need to do is your dietary modification, okay? So you have to eat less of meat, okay? Just mention 1 or 2 things and move on. Eat less of meat, take more of water, and then take more fruit and vegetable, just something like that. And also regarding your alcohol consumption, you have to bring it down to the barest minimum, because it has been found that if you consume more alcohol, it predisposes you to gout attacks. Also, your weight is of utmost importance, because if you gain more weight, okay, there is a chance that you might have another attack. So it's important that you maintain a BMI, something very interesting, a BMI between so and so, or less than 29, something that's very sweet. And then you're done with it, and then you're trying to check understanding, and then asking the patient, is there any question you have for me? Or do you have anything to ask or something? And then the patient, oh, I think that's fine, doctor. And we are good and fine. So one thing about this thing is this, and that's why the speaking group was created. Now, the idea is not for you to rush. As I said, move at your pace, move at your pace, move at a pace, but don't be too slow, don't be too fast. Move at a, normal pace. And then if you see that you are hooked up somewhere, don't keep on saying, go back and forth. No. Quickly, just look at the task again, look at what you have to say, and then just get rolling again. Okay, don't say, for example, advice on appropriate pain relief. I say, so I'd like to tell you about appropriate relief that you have to take. So pain If you're very confused, move on to the next one and talk about medical preventive treatment immediately, if that's what is coming to your head. Because the more you give so much gap, and the more you are saying, okay, looking for something to fill in, okay, they will score you low for fluency. You have to be very fluent. That's very fluent. And I always tell candidates, once you are fluent, seriously, you scored like 50% of the mark for speaking. Once you are fluent and clear enough, honestly, you scored at least 50% of your marks for speaking. So your fluency is very key, okay? And then you don't want anybody to take that, away from you. So very important. So I always tell candidates that there are 4 kind of scenarios you may have in your setting. 1, you may have you may have a new patient, okay? And when you have a new patient, you want to ask exactly what's the name and age of the patient. Okay, 2, you may have an old patient, sorry. You can give the patient a name straight up if you don't want to even, so Tunde, I can see that you are here straight up. I mean, you can give the patient a name, or you might just confirm. Okay, might confirm your name. Tunde, okay, Tunde, I can see you were here 2 weeks ago, admitted in the emergency department for acute gout.
Sorry, ask the question, please. Sorry.
Okay, please shoot. All right.
Yes. Task I did see. Mine is more like a if it was or repetition. So I think I knew patients beforehand, but when I started, I something like may I confirm your name and date of birth? Is that still appropriate for that particular scenario?
For new patients?
Or I should just go ahead and do what? No, my case was not a new patient. My patient was a.
No, you're just trying to confirm, so that's still fine. That's still fine. You can choose any of those options, okay? That's still very okay. All right, what I'm saying that alternatively, if it's a returning patient, you can give the patient a name. Any name. The interlocutor will accept it on the exam day because it's seen that you are with the case note of this patient, and then the name is written there, right? So you can give the patient a name. All right, but at the same time, too, if you don't want to follow that part, you can also still confirm the patient's name and age to be sure, okay, that is the same patient you're still dealing with. All right, so you have no worries with that. Okay, any of them you choose is still fine. Yes, please. All right, so it's very important, okay, that we learn this thing. So Dr. Biola, are you still on the call?
Yes, Dr. Ebuka, I'm here.
I hope you're following through.
Yes, I am.
What you need to know. All right. Okay, so Dr. Is anybody having an exam next week? Dr. Tadese. Tadese. Dr. Tadese.
Hello, Dr. Ebuka.
Who is speaking?
Good evening. It's Josephine, please.
Okay, Dr. Josephine. Okay.
Yes, I have a question before
please
you
shoot.
move on, please.
No, please shoot.
She did something very interesting that really captivated me, and I don't know, maybe we shall allow it slide, or we can actually learn from it.
Okay.
She did something about the patient actually is in pain, came in pain, and then she stayed back and said, "Do you think we should continue this conversation? Let me give you a pain relief." I don't know. It captivated me, and I'm like, is it something I should take? Because I don't. She understood this scenario and then wants to help this continue. So I don't know, what's your comment on that?
Okay, all right. So for example, if the patient, now it depends on the setting, all right. For example, let me just give you an idea now. So the patient can be in pain. All right. Now, if the setting was an emergency setting, should have been much more interesting. All right. For the patient to come to the clinic shows that there's some level of stability. All right. So when she was done with explaining gout, she said, explain gout to the patient. And then, after she was explaining it, the next thing is that she had to check understanding, right? Because you have to follow. Your pattern has to be followed, okay? So after she check understanding, from my own task, okay, I'm to find out what pain relief or what pain relief I'm to take, okay, from the doctor. So because it's a clinic setting, okay, you might not want to be in a rush, okay, talking about the pain relief because it's not an emergency. Assuming this setting said emergency and she did that, that'd be very fantastic. So you have to look at the setting. Patient came to the clinic, then patient can still manage the pain. All right. And then once you are done checking, understanding you. Just the patient responds to you, okay, I need to be on pain medications. And then what she was trying to say here was, should I administer pain medications to you? I think that was what she said or something. Should I stop this conversation and then give you pain medication? That's okay, that's fine. Okay, but then that should have been done maybe after the patient has asked you for certain pain medication option. Because now, this is a clinic setting. Okay, the patient might tell you that the pain has been worse than the previous one. The patient has taken aspirin before, but the pain is still there. All right. So you want to empathize with the person's pain and then ask the patient, okay, so there are certain options of pain medications that will be available to you. So you don't want to still go out of what is given to you here because it's a clinic setting. Now, if you had done that in an emergency setting, you would have given her more marks. Okay. So let's say this patient had like an acute gouty arthritis. Okay, maybe podagra. Okay, that's affecting like the big toe, and then patient goes to the. She did that. That would have been fantastic. Okay, but then as she did that, so she was already disrupting my. She was already disrupting my own flow from the interlocutor's angle. I don't know if you're getting my point. She was already disrupting my flow. So understand the setting is very, very important. Okay,
Please,
for the patient. Okay.
I'm so sorry. Yeah, okay.
So kindly rejoin once this link has expired, please. Continue, please.
So like she said, it was, I felt like it was something that I could like adapt, because if when I read the case notes, it looked like an emergency setting. So is the only time, are you saying that the only time that we treat it like an emergency is if the setting that is stated there is saying emergency room or something like that? Because when I read the prompt, I honestly thought it was an emergency, and I thought like, oh, it was something nice that could have been adapted.
No.
So is it only when it's emergency?
Yes, it's a brilliant attempt. Okay, I'm not taking anything away from what she has said, right? But then you have to also be very sure of the setting. The settings are very important. Okay, you can have, I've seen gouty arthritis question that came in emergency department. Okay, and then if you come in emergency department, even before you even start explaining gout or anything, the first thing you need to see is what she said. Okay, about administering pain relief, even before explaining anything.
Right now, if the patient says yes, so how do we connect from that to achieve the task? Do we say that, oh, now that we have administered some medications, may I continue, or how do we connect it? I don't know if you understand. I was supposed to ask like, I already administered the medication, or is the patient going to say no? How do we connect it?
Once you're just done, just go to the next task. Or they just want to see that you tried administering the medications. You get, okay? Because they know that it's not like a live thing. All they're just concerned about is what you are saying. I don't know if you get my point. This is like a speaking. It's not like a demonstration kind of class. So once you say, okay, so I can see you're in so much pain. Okay, Mr. Kennedy, so we'd like to administer certain pain medication. Can we go ahead? And then, oh, that's fine. And then you just pause for like some seconds. Okay, how do you feel now? Okay, so I feel much better. All right, so regarding your question, okay, about what causes gout, you see now, and then you just flow that way. And that is as simple as possible. All right, so Dr. Viola, you wanted to say something, please?
Dr. Buka, yeah.
Yes,
okay,
please shoot.
Thank you for your comments, and it makes sense actually. But I have two questions. The first one, from the second task, talked about telling the patient about pain relief drugs, and also that patient should avoid aspirin. Specifically in this task, no pain relief was mentioned. Aside from that, patient has used aspirin. I'm to tell the patient not to use aspirin again. And in previous discussion, I think there was a time one of our staff was like, we should try to avoid adding too much medical jargons that we know.
Yes.
That there are some things that are not mentioned in the tax. Try to avoid adding medical jargons. An example, I could have as well gone ahead to say, oh, there are some drugs that are called NSAIDs that can be administered instead of using aspirin and all. So, it was not mentioned, and they asked me there to give the patients to talk about the pain relief the patients we use, and it was not specified. So could I have gone ahead there to have mentioned a drug to giving the patient. That's one. Then the last point is the other point is about the last tax, saying that that I should try to explain the last tax, trying to say trying to educate the patient on how to reduce the frequency, and it talked about modified diets, reduce alcohol and all. Also, you when you were correct, when you were giving the breakdown of this, Mr. Tunde to talk about it, and also alcohol consumption. I feel here that a point means the patient continue to reduce recurrent attacks, and not specifically the patient taking alcohol or the patient being overweight, which was not specified in the act. That point to say, oh, they didn't mention that this patient was overweight. They are telling me the things the patient can reduce. So how can I communicate this to the patient?
I didn't say the patient was overweight. If you listen to me carefully, I said when I explained modifying diet, I said you cannot just say one of the things that would be beneficial for you in reducing this frequency of attack or this recurrence of attack is dietary modifications, okay? Which include you reducing your meat intake. I think I said something like that. And then maybe staying hydrated and thinking more of fruit and vegetables. Just one or two things, just to add to your vocabulary. Remember, they're not checking the correctness of your medical stuff. Remember, this is an English exam, but they just want to add one or two things in this modified diet. And then I went on to reduction of alcohol consumption. Okay, so you can, like I say, it's also paramount. Okay, those are words you can introduce high vocabulary. It's also paramount that you also reduce the amount of alcohol you consume, okay, regularly. One of the things that will also be beneficial is ensuring that you monitor your weight. So it's important that you maintain a BMI or a body mass index of between, something just to, how will I put it? Something just to stress. Let me put it that way, to stress on what you're trying to explain about losing weight. Do you get my point? So I'm not telling you it's overweight. I'm not saying anything. Okay, but I'm just saying you should maintain. Okay. All right, because of course he has to maintain a normal BMI, right? So it's possible that he may be overweight. I don't know about that, but I'm just telling him that try to lose weight and then try to maintain, a proper BMI. If someone is 40 kg, will I tell him to lose for that weight? I'm just saying, don't mind me. All right, so I'm just need to emphasize on the fact that there is a stressor, okay, on him losing weight. I'm not saying I didn't mention whether it's overweight or not. Okay, I'm just saying you should maintain an appropriate BMI. And then for this one now, you can also go to town and say, so it's important that probably you engage in certain exercises, okay, that can help you, lose weight and then maintain an appropriate BMI. And then you're already done with this. For this one, you can say it is paramount that, you engage in reduction, okay, of your alcohol intake. Okay, and then this dietary modification, you can just say one or two things. It's important that you modify your diet, by reducing, meat intake, okay, which has been found, to cause a recurrence or a relapse, blah, blah, blah. Then you mentioned that, okay. So you're not going to town, you're not going too much. But then whenever in OET, when they give you things like e.g., modified diet, reduce alcohol, they're just giving you headline. They want you to just touch 1, 2. You're not going too much, just 1, 2 about it. So you cannot just come here and just say, it's important that you reduce your frequency of attack by modifying your diet, reducing alcohol consumption, and losing weight. A candidate that do that will still get marks. But another candidate that says, modifying diet and introduce another new word, okay, such as reduction of your meat intake. They say, she said reduction of meat intake. That's a new one. They give you more marks. And that's why I always tell candidates, if you speak more, you add more words, and you likely get more marks. Okay, but then you don't still want to go to town, okay, explaining too much. For example, the mostly diet, I just went to 2 things. Reduce meat intake, stay hydrated or something, and then I move on to the next one. Reduction of alcohol consumption. Okay, it is important, it is paramount. Honestly, see 2 words you're using to stress, okay? And then losing weight, you can now use words like, I also like to encourage, okay? You can use it. So I encourage you to engage in certain activities that will make you to lose weight, just as exercising, as this has been found to be very helpful in also reducing the incidence or the frequency of, gouty arthritis or gout itself. Okay, so something like that, as simple as possible, you just move on with it. Okay, is that clear? Dr. Biola?
Dr. Ebuka, how about the second,
Okay. This? Okay, the advice on appropriate pain relief, avoid aspirin. You know, this patient has been taking aspirin. Okay. All right, so you don't want to be saying things like NSAID and stuff. So you can tell the patient, like, so I like to recommend, certain pain medications which will be given to you. You don't need to even mention it, okay, which will be given to you, after these clinic visits. However, what I would like to stress on is you should try as much as possible to avoid taking aspirin, as it has not been found to be helpful for your condition, something like that. So even though they said advice on appropriate pain relief, you don't want to be mentioning a lot of medical jargon, saying that this group of medication will give you NSAIDs. Doesn't make sense. Okay? Doesn't make sense. We know that when it comes to immediate pain relief for gouty arthritis, we know we're talking about colchicine, and NSAIDs basically. And NSAID includes the naproxen, diclofenac, aspirin, and stuff. But they don't want to mention a lot of medical jargon. They're very careful with it. Okay, so just say, we'll place you on certain pain medications that will provide instant relief for you. However, I would like to stress, okay, that at the moment, avoid the use of aspirin, as it has not been found very helpful, for your condition or something like that. So the patient does not necessarily need to know the exact drugs. You don't want to be mentioning naproxen, diclofenac. A patient is looking at you like, what are you saying, doc? Even though you mention it now, this is the way it works in OET. If you're going to mention it, you have to mention it that these are pain medications, such as, you can mention it in passing. That's why I say you can mention it in passing. So prescribe some other, stronger pain medications, such as naproxen, that will be helpful in passing. You're not going to be stressing on it, but then you can also be silent on it. But then bringing NSAIDs, saying non-steroidal anti-inflammatory drugs, necessary, okay? It's not necessary. You can just be silent on it and just. So the main thing here, if you look at it very carefully, they bracketed it, avoid aspirin. That's one thing they wanted to stress on. Okay, in as much as you want to tell the patient that there are other pain medications we will give you that will provide instant relief of your pain. However, I would like to stress, okay, I would like to emphasize that you should avoid the use or intake of aspirin, as it has not been found helpful in controlling your pain. And then you now go further to the medical preventive therapy. As simple as that, and then you move on. So avoid medical
Thank
jargon.
you.
As she said, avoid medical jargons. You don't want to be saying too many medical jargons as you drop your marks, okay, in the exam. So I'd like to have Dr. Tedasi on the call. I don't know if anybody has a question. So we'll have one more, and then because it will have another class tomorrow. So Dr. Tedasi, are you on the call?
Yes, I am here. Yes, I can hear. Can you hear me?
Yes, please. So I'll give you 3 minutes, and then at the end of 3 minutes, we'll commence your class. So please try and join tomorrow. We also have classes tomorrow. And those that are having exams, sorry, before you start, those that are having exams next week, Saturday, please, I'll encourage you to participate in the mock exams organized by the academy. I think it will be posted on the group soon. And then the information will be there. At least you can do 1 or 2 mocks. It will really be helpful. Most of the candidates that have written their exams recently actually benefited from the mock. It helped them to identify the gaps and how to close them effectively. So I encourage you to engage in the mock. So Dr. Tedasi, your time starts now, your 3 minutes, and at the end of 3 minutes, and please, in the exam too, even though you finish reading before 3 minutes, you can signal your interlocutor. So you don't necessarily have to wait for 3 minutes. If your body is hot or your body, the pepper, you can tell the interlocutor, signal him, and then he will comment. Okay, the 3 minutes is just the stretch. If you finish in 2 minutes, you can signal him and then you start. So Dr. Tedasi, if you finish in 2 minutes, you can signal me and then I'll comment. But 3 minutes is the maximum that will take. So your time starts now. Hear me?
Yeah.
So your time has elapsed, and then your speaking time starts now.
Good afternoon. I'm Dr. Tadi Shegunle, your attending physician. For today, please can I confirm your name and age, please?
My name is Tunde, and I'm 49 years old.
Can you hear me?
My name
All
is
right.
Tunde, and I'm 49 years old. Yeah.
All right, Sunday. I've read through your case file and I noticed you've been here about 6 months ago, but I would really like to know what brought you in today.
All right, so doctor, I'm quite confused. And I really don't understand what's happening to my arthritis. So about a week ago, I experienced this pain around my joint. It was extremely painful, and then it seems like this arthritis doesn't even want to go away. So I'd like to ask, is there no cure to this my condition?
Okay. Sunday, I do understand how you feel, and I know about this might be difficult to handle. However, I need you to be rest assured that we will try to get a solution to this. I would like to explain this rheumatoid arthritis. Is that okay?
Oh, that's fine, doctor.
Okay, rheumatoid arthritis is a chronic disease, a chronic condition that do not have cure, and it mainly affects your joints. It causes stiffness and all that with your joints, and this will not go away because it doesn't have a cure. And I need you to know that there's always recurrence, and you would always, have this symptoms and condition. However, I need you to know that it can be managed, and the current flare can be managed with medications. Do you understand that?
Oh, yes, I do.
All right. And so one of the things that would I would suggest to you, cope with this rheumatoid arthritis, enough sleep, because it's very important. I try to get between 8 to 10 hours of sleep every day, and also do well with making your diet very healthy. So include fruit into your diet and more vegetables. That would really, really help you. And I also know that long exercise, I've been trying to take at least 20 minutes walk 3 times a week would help you with
Sorry, everyone. Let me project the screen. You can continue. Sorry. Please continue. Sorry.
I can't see the screen.
Yeah.
I can't see the screen. I didn't want.
Oh, can anyone see my screen?
I can't see.
Oh, I've shared it again. It's supposed to show. Can you see it now?
No,
Not yet.
not
Oh,
yet.
wow.